I'm James Sutton. This is Road to Recovery. And my two special guests today is Matt Paris and Nick Borowski.
Thank you for having me.
Yeah,
Hi,
thank you,
gentlemen.
James.
So let me start with you, Nick. So can you tell us a little bit about yourself? How did you get here today? What was your road to recovery?
I was lucky enough to be arrested in Montgomery County, and that was the start of my finding recovery. Basically, in 2014, I was arrested and eventually got into the drug court program. Drug court program was an intensive program for me, and it was exactly what I needed. I was in jail, then PRC, then I went to sober living for a year, and then I eventually got a job in the field. And then from there, I now work at Second Chance, which is an IOP. So my first job in the field was actually where Matt works, Fresh Start Recovery Center.
Did he hire you?
So it was I was a behavioral health tech, and I was lucky enough to work there. So that was getting my feet wet. Okay. And then when Second Chance opened up in August, Dave, the owner, asked if I could do outreach for them.
Okay, great. Now, we do a lot of informationals about Narcan, and I understand you actually are here with us today because of Narcan.
Yes, shout out to the fire marshals, the EMS services. In 2014, I left treatment and they advised me to get on the Vivitrol shot because they said I was a high risk for relapse. And I guess call it a reservation, I turned it down, and shortly after, within 2 months, I overdosed for the first time. My father found me. It was my friend who found me, and he got my father, who was upstairs in the house. And 2 fire trucks came, a sea of police, and when they revived me, I even had court that morning for another charge. Mm-hmm. So I went to the hospital, and my only concern is to get out of there as soon as possible and make it to that court date, which I did. That morning, when I got to the courthouse in Silver Spring, I actually saw a couple of the officers who were called the night before, who couldn't believe that I was walking.
Right.
And that was my experience with Narcan, and it definitely, everybody needs it in the county. I mean, everybody should have it on them. Narcan should be in every restaurant, should be in every public place.
Right.
I mean, it is such a simple tool. So you can carry it anywhere,
Yes.
and you have the elixir of life, basically.
Right.
And I can't thank Montgomery County's emergency services and Narcan. Without them, I probably wouldn't be here.
Right. That's great. That's a great testimonial. Absolutely. So let me switch over to Matt, and we'll come back to you in a second. So Matt, can you tell us how did you get into recovery, or your road to recovery?
Absolutely. So I'm a believer that I was an addict before I ever picked up a drink or a drug. My disease took me down a very long, dark road, and it ended up with a very bad car accident.
Okay.
I tried getting clean once before on my own, and it didn't work. I'm not able to defeat this thing by myself, right? We talk about a we, right, in recovery. So eventually I got into a very bad car accident, and that was my awakening, if you will. I was able to realize that there was something out there keeping me on this earth for a reason, right? I had left anyone who cared about me and anyone who wanted to see me succeed due to my disease, right? And the biggest one being, my spiritual sense, my higher power, my God, if you will. So eventually, I reached out for help finally. I looked out to my mother, who had always been a support for me, but again, I had distanced myself from her because of the disease. And she got me the help that I needed. She put me into an intensive outpatient program, who introduced me to Narcotics Anonymous, who introduced me to 12-step fellowships, and I eventually returned back to the church where I found my connection with a higher power once again, and that was huge for me. It was so important for me to find that spiritual sense that really gave me guidance, right? Because again, I couldn't do this by myself. I got clean when I was 20 years old, and I could barely put a sentence together, let alone do any type of positivity in my life, right?
Yeah.
So for me, it was leaning on other people, having some faith, and taking a chance to find recovery. And I was very fortunate enough to do so. And then from there, I was able to get back on my feet, humble myself. I finally became employable again. Around 2 years, I was employed by a local state agency treatment center, Avery
good.
Road, that I was able to work at for several years, which was an amazing opportunity for me.
Yeah, I loved it. I worked there too.
Yeah, to get my feet wet in the industry and be able to serve. I found my passion was helping people when I first got clean. So from there, I worked there, and then I was able to serve in the juvenile justice system with the adolescence program, because I love working with young people, right? Getting clean at a very young age and finding recovery. I wanted to give back to the younger population and do some prevention work.
Sure.
And then just recently, May of 2017, we opened Fresh Start Recovery Center. And our goal, just a little backstory on that, I remember I had about 90 days clean in recovery, and I'm sitting with two of my dearest friends, Nick and Kabir, and they're talking about opening up a recovery center one day. And I'm still in post-acute withdrawals.
Right.
I'm not feeling too hot, and I said, you guys are crazy, right? And then 5 years later, we're sitting in this office building overlooking the same highway that I crashed my car in, the
Get outta
same
here.
mile piece of highway
Wow.
where I
Wow.
crashed my car, and the time had arrived.
Wow.
You know, and we were able to open up Fresh Start Recovery Center and bring some more recovery to our county, right? Which was our goal. We wanted to bring more recovery resources to Montgomery County, and we've been so fortunate ever since. So what really excites me about it is the new model that we have, which is our partial hospitalization with an accompanied housing, right? So we're able to mimic that inpatient feel of treatment, but also being connected with our community, right? Continuing to build the recovery community here in Montgomery County and bring more resources to the county.
Right. Yeah, that's the first use of that model in the area, and it seems to be working well. So do you use your vans to transport people from the housing to the program?
Correct. So they're in the housing from anywhere from 30 to 60 days. They get transported to and from housing and our clinical space, and they're in that clinical program Monday through Friday from 9 to 3:30 roughly. So they're getting individual treatment, group therapy. We are a co-occurring facility, so we have our medical director, our psychiatrist, Dr. Miriam Parveen, as well as a psychiatric nurse practitioner to help address any mental health concerns as well.
That's great. And that's a great addition to the spectrum of services in Montgomery County, because that was a missing link.
Absolutely.
Housing is always a problem. Yeah. Now, I visited Second Chance. You guys had me over a few times. We did a Narcan training there.
Yes, we did.
So you guys are really coming in, with both hands, getting dirty too.
Right.
So the area that you're in is kind of, it's very affluent. You're in Potomac, right?
Yeah.
And how's the response been for your IOP? And I understand you started a family program too there, right?
Yeah. So
can you tell us-
bi-weekly now we have, we facilitate a family support group open to everybody in the community. You don't have to sign up or sign anything, pay anything. You can just come in and get an education, and also a process group, because what we've learned is that, this is a family disease. When you're in active addiction, it affects the family. So we actually give a process group for free to any members who want to come in.
Wow, that's great.
Community. And although at Second Chance we don't have housing, we work a lot with sober living, Stepping Stones, Oxford, and so where the PHP model is great, and that's such an important piece, But I just like to say Second Chance doesn't offer housing, unfortunately, but we do work a lot with other providers of housing. So if you get on that, James, we'd like to talk. Another thing is, at Second Chance, we work really closely with drug court.
Oh, do you?
So
Okay.
yeah, as an alternative, most people who go through drug court go through outpatient addiction services. So in conjunction, sometimes they'll send their participants to us at Second Chance.
That's good that they have options.
Yeah, so it being in Potomac is kind of a way. You'd think, it's 15 minutes away from the Pike, which is everything's on Rockville Pike. But that's been no barrier. I mean, there's a bus that gets there, and surprisingly, it's worked out really good. Everybody loves it.
That's good, because I know a lot of times transportation can be a barrier to treatment. So I was wondering, when you have a service and it's not really accessible, how well can you do? But you said it is accessible by bus.
Yeah. Yeah, and we even, also what we do is if you're not in pre-release center, if you're in drug court and not outside of pre-release center, we'll even Uber you.
Oh, wow.
There and back.
Great. That's a great service. Now, I understand you guys do Vivitrol too?
Yes.
Okay.
Yeah, so Vivitrol, and we offer Vivitrol and Suboxone. And we utilize Vivitrol whenever possible. That's our go-to, and I think Matt would agree. It's like the most powerful.
You guys too?
Oh yeah.
So we work off the abstinence-based model, but we do provide Vivitrol as a medication-assisted treatment.
Oh, good.
Yeah.
Because I love Vivitrol because it's not addictive.
Right.
For those that in the audience that don't know about Vivitrol, it's actually medication-assisted therapy that can assist in a person's recovery process. Right. And it can be paid for by Medicaid, right?
Yes.
Absolutely.
Yes.
So I really like it because the fact that it doesn't have to be an addictive, replacing one habit with another habit.
Right.
So that a person can actually stop it at any point and they won't get any withdrawals.
Yep.
You can't manipulate it.
Right.
You can't sell
can't
it.
divert
you
it.
can't take too much or too little.
Great point.
It's a much safer alternative.
Yeah, you're not going to have an overdose, and you can't divert it. It can't be.
Now, there's nothing wrung with going on Vivitrol. I remember in Avery Road, Matt tried to talk me into it. And I said, no, I got this. I know what I'm doing. I was wrong. It's, ideally when someone's in an inpatient setting, they can get on Vivitrol, and we'll follow up with that at Second Chance. We'll give them their second dose. So, when you're at the jail, I know you push for getting someone that first Vivitrol shot before they leave, and the difference that would make.
Oh, yeah, especially in the jail. I mean, I really advocate for anyone that's an opiate person, an opiate-dependent person. When they leave the jail, they may celebrate getting out of jail. So corrections has been very supportive in that we'll actually give you your first shot while you're in the jail, so that when you leave, we have a better chance of you surviving.
That's great.
So corrections has been really supportive with that particular, model. So we're coming at a little break right now. When we come back, I want to talk a little bit about peers in recovery, because both of you guys are people in long-term recovery, and we have a growing peer workforce. I want to know if you guys, what your take is on the peer workforce. Is it useful? Is it, is it going to replace counselors? Because a lot of counselors think that, peers are here to take their jobs, but
Right.
I want you guys to talk a little bit about the role of peers. You're a peer recovery specialist?
I'm a coach, so I'm
Oh, you're a recovery coach?
Yeah, en route to be certified.
Oh, okay, and you're working on your certification?
Yes.
And Tree of Hope can help you with that.
Oh, yeah. Yes, they did. You were there, James. I can say that.
And what about, do you have any peers?
Yes, I'm personally a coach as well.
Oh, okay.
On my way through Tree of Hope as well.
Okay.
And then we do have peers on site at Fresh Start as well.
Yeah, because I know Melissa was here, and she did a great job. About 3 weeks ago, I think she spoke here on the show. And Francesca, I think I've seen her at some of the trainings. So
Yes.
that's great. And you support them in coming to the trainings.
Absolutely, yes. So Fresh Start will help assist anyone who is on our staff willing to become a peer and put in the footwork.
And that's really important, because when you have a new model, when the management, when the top buys into it, it really helps the whole organization grow, and be being open-minded for change,
Absolutely.
So it's great that because I would call you at the top, okay? You at the top,
He is.
suggest for your workforce to be well-trained.
Right.
That's great.
Absolutely.
So I think we're going to take a little break right now, and we'll be right back with Matt and Nick, and this is Road to Recovery.
They gave me Vicodin after my knee surgery. They kept prescribing it, so I kept taking it. I didn't know it would be this addictive. I didn't know how far I'd go to get more.
opioid dependence can happen after just 5 days. Know the truth, spread the truth.
We're back with Road to Recovery. My two good friends, Nick and Matt. And what were we talking about, peers?
Mm-hmm.
Okay, so what's been your experience being a recovery coach and working in the field of addiction treatment?
So the peer movement, from what I've gathered, is just a different perspective. It's different language you use. It's being on the same level and meeting a person where they're at. Okay. So I guess the 12-step model, would be like, I'm your sponsor, you got to do X, Y, and Z. Right. This is clean, that's not clean. The peer movement is just like, what's going on? What's working for you? What have you tried? It's asking open-ended questions. Right. It's just a new perspective that I think that is very needed in this county, and I'm glad to be a part of it and to see it boom.
Okay, great. What about you, Matt? What's your experience with the peer movement and recovery coaching?
So several years ago, I went through the peer recovery coach trainings, and I'm still in the process of becoming certified myself. At Fresh Start, we have several peers on staff, several people Good. Who are coming through that process as a coach and headed to be certified. But as Nick mentioned, the biggest thing is the perspective, right? And I like the language you use, meeting them where they're at, right? Mm-hmm. As a person in long-term recovery myself, when someone is just bossing me around or giving me direction like that, it doesn't work too well. Right. I'm a pretty hard-headed guy, and I like to do things my way. But if you can come at me from a different way and continue to be supportive, I think that's the biggest part about having peers, and to bring them into different roles, such as in the hospitals, the health departments, the treatment facilities, and making sure that we're wrapping them up, right, with full services. I mean, at Fresh Start, we have therapists and counselors and case management right. staff, but this is someone who they can come to and just talk freely, right? It's not a behavioral health tech who's bossing them around all day or a therapist who is trying to nurture them in such a way, but this is someone they can just get on a level with.
Right,
and hopefully make a difference. And I think it's very important. We try to employ a lot of people who are in recovery at our center.
Yeah, I noticed that.
But not only just having their own life experience, we want to help build them up, and we'll offer our services to get them through those trainings and make them educated throughout this process.
Right, that's great. It's a great agency to work for.
It is.
Right. Now, also, with the peer movement, we don't only work with people in treatment, we work with the people that get put out of treatment.
Right.
So with your experience and your road to recovery, do you think you would be effective working with a person that got put out of treatment? Why?
Well, I think that having a peer in the puzzle, you can't go wrong. I mean, it's just one more layer. So even if a client gets thrown out of treatment, I mean, the peer you can always call. It's always, it's different than the clinical boundaries.
Right.
It's kind of more as equal a friend. So, like you'd call a friend when you're in trouble. Like, okay. This is what happened to me, X, Y, Z, this is my situation. A peer would hopefully be able to find another place for them to go. It's just another level of somebody in the field on the front lines. Outside of treatment, inside of treatment, even what the peers do with the steer movement. I mean, you can get arrested mm-hmm. or overdose, and a peer is going to show up and evaluate you and offer you help.
Right.
I mean, I think the more that peers are placed in the hospitals, only good can come from it.
Right.
And I think they're realizing it because, I think peers, it costs less money than somebody who went to 6 years, 8 years of school, and hospitals. I know MedStar Montgomery implores them, mm-hmm. Suburban, and people are realizing just how knowledgeable peers are without any formal education.
Right.
Yeah. They have that life education.
Well, the life experience, and then the training of how to be a professional.
Right.
Because a lot of people think because a peer, has lived the experience, that's the connection, yes, but they also are trained. Because what you were just describing as an open-ended question, that's motivational interviewing.
Yep.
So that's a technique that you learn in recovery coaching that helps you really assess where a person is and meet them where they are and help them get to where they can get to a healthier place, right?
Absolutely.
So that's important because, like you said, when a person leaves a treatment, against medical advice, they're discharged. So you can't really deal with them anymore legally because they're discharged from your program, but a peer can. So a lot of people who don't want to be in treatment in the first place, that need help, a peer is able to sometimes redirect them. Like you said, if they get put out of Avery Road, they may come to Fresh Start. So there are a lot of options. There's not just one size fits all in Montgomery County. If a person doesn't work well in OAS, they may work well at Second Chance. So we want to make sure we have a lot of options for the community to get into a better health,
Absolutely. And one of the things that Fresh Start does is we have the alumni program, right?
Oh, you
so
got that, okay.
we had previously hired an alumni of our program who was able to succeed in her own long-term recovery. And now she has built an amazing program where she is becoming a peer through the CCAR trainings, through Tree of Hope, and able to reach out to people who have either been discharged from the program or are currently looking for treatment and be that resource, right? Be that peer who has the lived experience, has the professional training, and like you said, build the community, right? Is to continue to bring the community together. And whether they're coming to Fresh Start or not, we're not opposed to calling Nick or calling these other providers in the community to bring people together. The word competition drives me crazy in this field, right? There are so many people sick and suffering in our community that need help, and there's not one single treatment center that could help them all, right? We need to be able to work together and bring the community together to make sure that nobody's slipping through the cracks.
And you two guys lived the experience because you help each other in each other's recovery role, and we know that from the 12 step, when A helps B, it helps A the most.
That's right.
Yes, sir.
So we all are benefiting, when we help the community. And it helps us, and like you said, that's your passion that you discovered in your recovery, helping people, and you do a great job. I remember I saw you at the event for the mothers of people with OD, Soul.
Yes, the overdose awareness event from Montgomery County.
And you were associated with Laura Lee, because I thought I saw you over there.
So I had met with many of the other vendors who were there that day from all of the other organizations. You had Soul Surviving Our Ultimate Loss, which was one of the mother groups there. Laura Lee from Nathan's Ridge was there. There was plenty of other vendors, Colmac, a lot of different programs. But I was there with Fresh Start that night, but I was also asked to speak. Judge Bernard had asked me to speak and share my personal experience that day. And it was a very powerful evening.
It really was. It was the first one I went to, and I was really moved. I mean, I hadn't been to any. I had seen something like that in a movie from Connecticut, but it's the first time I went to one here, and it was very moving, powerful, really powerful experience. And I knew some of the people that had OD'd that year. So, what else in the recovery movement? What do you think some of the gaps are that we can be concerned with, that we can work on individually and collectively to improve the services in Montgomery County? What are we missing?
I think the biggest thing would be the housing.
Housing.
Unfortunately.
I'd agree.
Right now, you've got a lot of people, when you're at the end of the road and you're finally willing to get some help, I don't have very much money anymore, or else I'd probably still be using. And I've probably burnt a lot of bridges, So being able to help someone find treatment at an affordable cost, but then help them find housing afterwards, right? A lot of people either end up on the streets or aren't allowed back home. So
that's true.
We need that extra accountability, that extra structure that a structured sober living could provide. But there's just not enough resources. There's not enough housing available for people who are struggling and in that intermediate time in their recovery.
Is that because Montgomery County is the housing cost is so high, or just a lack of participation of the business community, or we just haven't done it? What do you think some of the factors?
Well, I can just speak from, since I've been doing this in August, the winter, the season's affected. In the winter, people suddenly want to go to treatment, and most of the places I've called, you know, over the winter months, everybody's full. There's waiting lists, and if you have somebody,
true.
you know, who gets out of treatment and they're literally couch surfing, waiting to get into a place, well, they're coming in IOP, and it's sad, you know, because in those moments, you know, that's so easy to say, you know, well, I'll just call my old friend. You know, he always let me sleep on his couch.
The drug dealer?
Well, yeah, you know, but I'm not going to use, right?
Yeah,
I'm just going to go, it's just shelter, you know, so the more housing, the better. I mean, there's so many different independent agencies, you know, there's Stepping Stones.
Yeah, sober
there's
houses, yes.
Oxford, XYZ, and, you know, if there was some kind of, something through the county, something central.
So that's a great idea. We had a central housing, you know, fund,
Right.
or the county could back us on housing. So we're coming to the end, and that's a great subject. We could do a whole group, you know, a whole show on housing because that's our greatest need is things for mental health and for addiction. So you guys want to take a minute and give us a take home. You know, what really do you want to like leave with the audience? Just a thought you want to.
James, I think the biggest thing I would like to leave is that there are resources available,
Okay.
right? Letting people know that there are resources in our county. We are very fortunate here in Montgomery County. Not to say that we don't need more, but to reach out and ask for help, right? To help bring the recovery community together, not leave any gaps, right? And to continue to build each other up, to ask for help, and it is there. We do have the resources, so
Okay.
to continue to ask for help.
Okay, great. What about you, Nick? Any closing remarks?
Yeah, I'd say the same thing, that Montgomery County is the best place to get clean,
Yeah.
and has the most resources to strengthen your recovery, whatever you may choose. And Matt's phone's always on, my phone's always on. You know, follow me on Facebook, reach out to me anytime, and I'm sure Matt would agree that, you know, we're here to help, whether it's coming a second chance or finding you the best place. There, you know, we want to lower the barriers to treatment,
Right.
in all forms, and we are happy to do that. I can speak from my person and for Matt that, you know, this is what we want to do. This is our purpose. This is why we're here.
Right.
And you just got to reach out. You got to ask for help.
That's right.
Which is
And
difficult.
It can be
to ask for
difficult,
help, yeah.
but hopefully more of us coming out on programs like this to say we did it, and we're here to help. Hopefully, you know, yourself,
Right.
you know, this is why we're here.
Right.
You know.
Well, great. Thank you so much. So this has been Road to Recovery. I'm James Sutton. My guest today was Matt Paris and Nick Borowski, two great guys that are in the recovery community trying to make a change. And we'll see you next time on Road to Recovery.